talk to me, because there's a lot of push on not just treating symptomology, but going to origins and this attachment wounding and the intimacy disorders that can be attached behind the addiction.
Absolutely. So there is a lot of research that shows that people that struggle with CSBD, sex addiction, that they have much, much higher rates of insecure attachment in both females and males. And this comes from trauma. When people
Yes.
aren't there for us, when we're young, in all sorts of different ways, we learn not to trust them. And, rightly so. And then we don't learn how to co-regulate our emotions, which we learn how to do with one another as we're growing up, right?
Right.
How to regulate our emotions. So they've been traumatized. They don't have anybody there for them. And what's the natural thing but to look for a way to take care of their pain? Because they're in pain, because that's not a natural state for us as humans. We need people, we need love, we need nurturing. And when we don't get that, it's excruciating.
Right.
And so it's, in my experience, it's it can be any addiction, it's whether it's gaming, whether it's food, whether it's chemicals, whether it's sex. It's just another way to self-medicate
And feel better. Right.
and feel better, right? And yeah, and so it really comes out of oftentimes, complex trauma as well, like not just one or two instances of trauma. Many of these clients have many instances of
Right.
trauma.
Mhm.